So he had a very complex ablation by Dr. Edward Gerstenfeld at University of California in San Francisco. He had epicardial circuits that were ablated from at the left ventricle and the right ventricle, but there was one circuit that was close to his left anterior descending artery that could not be ablated. The ablations were extensive, and Alfredo had to receive a blood transfusion as a result of the ablation. I think one of the decisions that helped Alfredo a lot was the awareness that if he had to receive a blood transfusion, that it had to be blood that was leukocyte irradiated and has been screened for CMV. So it was CMV negative. What was in our minds is that if this condition persists and continues its aggressive course, which has been particularly aggressive in Alfredo, he is rushing headlong towards a heart transplant, which is the only cure for a condition like this. So if you had received blood transfusions before and you would receive a heart transplant, the chances of you rejecting the heart will be so much higher than somebody who has not received any distant blood transfusions and then had a heart transplant. So we were very fortunate to have the foresight to inform the staff of the University of California in San Francisco that if Alfredo were to need any blood transfusions, that it had to be leukocyte irradiated and CMV negative.
What does CMV mean?
Cytomegalovirus negative, which reduces the immunologic reaction towards the blood transfusion itself.
And this was, I was able to communicate this, not only did Dr. Khoo communicate this, but the whole time that I was undergoing all this, I was able to communicate with Dr. Khoo via text and on our cell phone, which was very important to me. It allowed me to have faith and confidence. It comforted me knowing that I had her there because she knew me better than anybody else. And I was very scared to have other people start to work on me.
I can imagine.
Yeah, so that was very comforting for me. And I remember before they took me to surgery, I kept saying if I needed blood transfusion, I was talking to the anesthesiologist, it's got to be CMV free, it's got to be irradiated. And you know, I think the importance of this is because there are known cases where people do have received blood transfusions and then have had a heart transplant, and their incidence of rejection is higher, as Dr. Khoo said. So back to having received those ablations in San Francisco, having the knowledge that he was not able to ablate these regions, he knew that they were eventually going to mature and become problematic, which meant that the way it was explained to me, that I would constantly be getting shocked. I would constantly be having arrhythmias because of these regions. And there are only so many times that the defibrillator may be successful. And there are only so many times that you get shocked, wherefore eventually it's just not going to work. Right. Your heart can only take so much of this. And so based on that information, Dr. Khoo had the foresight to know that I needed to be put on the transplant list, the nearest transplant center, University of Colorado in Aurora. And she scheduled transplant evaluation for me, and I went down there in July of 2013, just a few months after my big procedure in San Francisco. And fortunately, I passed all of their evaluations. I was a good candidate. I had taken care of my body. The only thing going bad in my whole body was my heart.
How did you emotionally deal with the diagnosis, though, from San Francisco?
You know, it's interesting because I just kind of had to go through the motions. I needed to stay alive. It turned my life around. Emotionally, it was difficult at times to understand that now things are changing for me. It's not just temporary, it's permanent. And now I'm looking at a heart transplant, and nobody ever imagines that they would be the ones to get a heart transplant, especially when I was in college running 10 miles and doing everything. But hey, it was my situation, and it was what I had to go through. So I just said, I'm gonna do whatever I need to do to stay healthy, to stay alive. And I love life. I have a wonderful wife, I have a wonderful family, I have kids, I have friends. I had businesses, I have a career, I have a lot to live for. So I just moved forward.
I think Alfredo succeeded as someone who has gone through so many challenges. And this was if you look at each and every step along the way, those were very, very significant events. And he was able to internalize and move forward in a very positive fashion because I think of his outlook, his strength, and as well as the love and the strength around him. So if there was anyone who could make it, it was him. And I was so proud of him every time he faced each and every step, and that he was able to internalize, process, and surmount it quickly and move forward with so much optimism.
As his physician, were you ever very scared for him?
Not particularly, because in the end, I had put him with the best there was to offer for him. And Dr. Edward Gerstenfeld did the best to his ability, and I was very confident that Dr. Joanne Lindenfeld at the University of Colorado was going to find a heart for Alfredo. So all these individuals worked very hard and fought very hard for Alfredo. This is the best that American medical care has to offer, and it's amazing.
I would say that's one of the reasons, that's one of the things that really helped me a lot, knowing that that I had.
And she was positive, obviously.
She was, of course, yes, and confident, and that's what I needed out of her, and that's what I got, and I knew she was looking out for me, and I knew that she was giving me the best care. I trusted in her, and at that moment, that was kind of difficult for me to do because I had interacted with some physicians early on who seemed like they were giving up on me, and they were just wanted to medicate me, and that would have ultimately, as we know now, would have caused me to not be here. But so she put me in touch with Dr. Edward Gerstenfeld, who she told me that was one of the best surgeons in the country for this procedure, so I was confident. I went to go get my transplant evaluation. Dr. Joanne Lindenfeld, she's world-renowned. She's an amazing physician. I had ultimate faith in her, and the team over there at the University of Colorado, the success rate for transplants is over 90%. And so that was very comforting for me. So I went there, I did my transplant evaluations. I passed all the testing, thank goodness, and I was a good candidate for a heart. I was listed on August of 2013. I got the letter, officially listed. I was listed as a status, it was an active status, but not the most critical status. I wasn't hospitalized, even though my condition could cause me to die immediately. But I wasn't hospitalized, I didn't need IVs at home, so I was able to go home and be on the list. I was on the list for about 1 year and 9 months, and besides the occasional arrhythmia, the occasional fatigue, the occasional problems here and there that I would go see Dr. Khoo for, I would get stabilized. I was actually resuming back into my life. I felt very comfortable for about 1 year or 9 months that, hey, maybe by some miracle I'm going to be okay and I'm not going to need a transplant. But I remember March of 2015, March 11th of 2015, my wife went to a study group. I was at home with my 15-year-old daughter, and we decided we were going to make pizza together, homemade, and we were going to watch scary movies and have a good time together. And I remember pulling the pizza out of the oven, and without much warning or anything, I just suddenly began to feel extremely dizzy. Similar feeling. My heart, I could feel it pounding very rapidly. I grabbed the counter. I ended up sitting down at the foot of the refrigerator, and I knew what was happening. And this was a problematic situation because there's my 15-year-old daughter. I don't want her to see this. So she looks at me and she asked me if I'm okay. I reassured her that I'm fine, but I knew what was coming on, and I was scared. And by somehow, I found the strength while I was undergoing all these arrhythmias, feeling very dizzy. I stood up, I went outside of my front yard into my front balcony, and I sat down, and sure enough, I did get shocked a couple times. And I knew, and I called Dr. Khoo immediately on her cell phone, and I said, it's happening again. And the interesting thing is Dr. Joanne Lindenfeld, I was so stable, she was getting ready to downgrade me, put on a status 7 inactive, which means I wouldn't get a call if I had a heart available because I was stable. But I wouldn't lose my position and my seniority on the heart transplant list. But that wasn't to be the case. On March 30th, Dr. Khoo arranged for me to go down to the University of Colorado to get a catheterization to evaluate the status of my heart and the condition and the progression of my disease. Now I was under their care because I'm on their list as a transplant patient. I went there on March 30th. I drove with my wife and my daughter.
What year? 2000?
2015.
Okay.
This last year.
Okay.
March 30th, 2015. We drove together. For some reason, after I had been shocked that time on March 11th, usually I'll bounce back and I feel a little bit better. For some reason, on that moment, after that, I just didn't feel like I was bouncing back. I wasn't able to get my energy back. Things weren't right. I wasn't feeling good. I knew that internally. I just felt it. Something changed, and I was not going to get better this time. It's like things were just going to get worse. I just felt it. So I went to University of Colorado March 30th, and they did a right heart catheterization to check the pressures internally of my right ventricle. And sure enough, they told me that my condition had progressed quite substantially. And I went into the recovery room after my procedure. And one of the probably good things is that, you know, my physicians and the nurses, and I'm there in the ICU or in the recovery room, my monitor started going crazy. I was having ventricular tachycardic episodes right there in the recovery room over and over again. And they realized at that moment that I needed a heart. I needed one right away. So I went, I stabilized after my medication from the procedure. I went to go see my cardiologist, Dr. Eugene Wolfel, wonderful cardiologist that Dr. Khoo wanted for me to see him. And I went to go see him to get the results. And he was telling me that my condition had progressed. I needed a heart, and I needed one pretty quickly because there was nothing more that they could do. And so I'm sitting there with my wife, and
I'm sorry.
so this is when things get a little bit real for me. So now I need a heart, and they don't know when I'm going to be able to get one. So I literally started to think about life and death. Am I going to make this? Am I going to survive? And all of a sudden, Dr. Eugene Wolfel, he gets a smile on his face. And I'm thinking to myself, why is he smiling? But it's a miracle, and it's also, you know, the medicine working for me at its best at that moment. But that day he told me, we got a call today and you happen to be here, and we have a perfect match, what looks like a perfect match for you, blood type, everything, and we may have a heart for you today. Can you stick around? So of course I'm going to stick around. So I am there, and whenever I tell this story, for some reason this part of it just kind of chokes me up, because you know, this is I believe this was a true blessing for me. And at 3:30 in the morning, that next morning, I was in surgery. I did get my transplant. I got a new heart, and my recovery went extremely well.
Wow.
It went extremely well. I was extubated 6 hours after my procedure, which is usually quite quick. I was on my feet, standing up and marching in place 27 hours after my transplant. 2 days later, I was walking, and I was downgraded to the ICU, and I was doing well. And 9 days later, I was discharged.
This is truly a miracle of American medicine at its best. Because when Alfredo had recurrent ventricular tachycardia, and we knew it was this circuit that could not be ablated, and when he called me with the defibrillator shocks, I knew he had to have a heart transplant, right? And at this time, Dr. Joanne Lindenfeld had already left the University of Colorado and had taken up a position as the director of the heart transplant program at Vanderbilt University, my old alma mater. I had called her immediately as soon as Alfredo told me about his shocks. And at that time, she was giving a talk in a major conference in San Diego. So when I found out that she was no longer in the University of Colorado, I had to pick another transplant physician, and that was Dr. Eugene Wolfel. And we had to scramble to get Alfredo to University of Colorado as soon as possible. And at that time, Dr. Wolfel was away on vacation. So it was amazing what Dr. Lindenfeld and Dr. Wolfel were able to pull together so that Alfredo could be seen as soon as possible. And during this time, I think Dr. Lindenfeld also made a lot of phone calls on behalf of Alfredo for the heart transplant.
So there was all these physicians from all these universities and hospitals working together.
Yes,
That's beautiful.
yes. When you work so hard for what you have been trained for, and you accomplish a result like this, Alfredo got a heart on the very day that he arrived that was a perfect match for him. It cannot be but a miracle. Yeah, and they have never seen anything like this before, and his recovery and his discharge was at record time. I mean, it is one of the best outcomes out there in the heart transplant world. I am so proud of Alfredo, and we are so proud of the team at University of Colorado.
That is amazing. Amazing.
And look at him.
I know, look at
He
you.
has beautiful rosy cheeks.
Yeah, I feel I feel fantastic.